Okay, welcome everybody. I'm Kathy Hartnett, and I'm the Executive Director of Global Recovery Initiatives Foundation. Welcome again to one of our great programs because we have so much talent included in all the people who are part of this national movement for recovery-friendly workplaces. So I just have a couple of updates on GRI and the Institute that I'll give you, which is that we have our certification seal is done, which many of you know. We have 15 certified companies. We now have uh, several more in the pipeline that will be certified in the next month. We are going to put out a report in September, and we're going to be reaching out to lots of you because we want to do a national report of all the employers who have been certified across the states as well as nationally and the number of employees they represent. We think it's a perfect way to do Recovery Month is to announce the incredible advancement. I'm also excited to report that there was just a plenary panel at the RX Summit. First time Recovery Friendly Workplace was a plenary session, and hundreds of people stayed after the Kennedy presentation to hear it, and it's getting great reviews. And we had two employers there as primary on the panel, as well as the CEO of Forest Marsh, who did a lot of the research. So thank you all for your participation. And today I'm going to let Eliza will take over and introduce our panelists. And I'm really excited for you to hear from some states that are in various stages of their work, but doing really substantial work.
Hi, everyone. I'm Eliza Zarka. I'm the program director working on the National Recovery Friendly Workplace Institute. I'm super excited to introduce our panelists today. We have Sam Lewandowski and Jeanne Venuti from New Hampshire Recovery Friendly Workplace, David Shapiro from Colorado Recovery Friendly Workplace, and Jeremy Drucker, who will soon have a Minnesota Recovery Friendly Workplace, and I'll leave the specifics to him. So first, we'll start with Sam, and we're ready to learn more about other state models of recovery friendly workplace.
Awesome. Thanks, Eliza. It's so exciting to be here with you all today. I've probably met some of you before, but hopefully some new folks in the crowd as well. I'm just grateful to you all for kind of keeping this group going, and to the Institute for kind of how they've taken things and really continued to evolve them and build them. And Eliza's just been phenomenal, and Kathy has been so supportive. So really cool to see the work continuing at the national level and really growing there. So today, I guess I kind of forgot to introduce myself. My name is Sam Lewandowski, and I'm the Senior Director of New Hampshire's Recovery Friendly Workplace Initiative. It's an initiative of, initially it was Governor Sununu, and now Governor Ayotte. It's one of her initiatives, and we are administered by a nonprofit organization called Granite United Way. And today I've been tasked with talking about not so much like what is the New Hampshire model. I think a lot of people are familiar with it to a degree, but kind of focusing more on how we've evolved, where are we now? And so you'll see me make reference to kind of where we've been quickly and then pivot to talk a little bit more about how we've evolved since then. And then you'll get to hear from our fabulous Director of Workforce Development, Jeanne Venuti. She is leading a scope around a newly launched workforce development arm, which is super exciting for us. And so I am leaving her to speak to that since she is the expert there. So really quick, just in terms of our org chart, I wanted to start with this because I think so much of RFW comes down to your team and the people you hire. And that's in large part because, at least for what we've seen in New Hampshire and maybe more with like the small and medium-sized workplaces, building that relationship with key business contacts is everything. If you don't have that, it can be really hard to advance the work. And so the main way that we do that is through our staff, especially our recovery-friendly advisors. So we knew that, and we also knew that there were certain needs that were emerging throughout the work that we kind of wanted to think about what would a slightly more evolved org chart look like. And so this is where we are now. And so, like we mentioned, we have Jeanne doing our workforce development scope. I now have an assistant director to help me, and she's really focused on the day-to-day operations and really supporting those advisors. So we have 6 of them. One of them is a pilot kind of thing that we're doing where we tried subcontracting with a partner in our North Country so they could kind of be like a little more embedded in that community. And that's been a really insightful process. We've learned a lot from that. And then a new position for us is that of the RFW support coordinator. So I know my team might not feel like this because they still have a lot of tracking and reporting that they have to do. But one thing that we really heard from staff was like, there's a lot of logistical, administrative, marketing, data organization pieces, and it kind of felt like it could pull them off of their roles. And so it's like, let's see if we can do this a little more efficiently and pull somebody in to kind of handle some of those pieces so they can stay a little bit more focused on the business experience. And that's been incredible and so helpful. It also helps me be able to kind of focus a little bit more on project management, higher level strategy. But some of the core components of our model are definitely in the same workplaces. We really center the workplace experience in everything we do. I think it's part of why we've been successful to the extent that we have, because we really try to make this a business-friendly initiative. Because if we can make it resonate with the business community, then we can have it be recovery-friendly from there. Still partner closely with our public health networks, our recovery community organizations, and other local recovery resources. We really see local recovery resources as the experts on their community, and we're helping kind of coordinate and bring awareness and education to a lot of the wonderful things that exist in our state. We get this question a lot. People are really interested in how we're funded. So this is our initial funding came from governor's discretionary funds, a one-time $1 million appropriation from New Hampshire's Community Development Finance Authority, and then a $200,000 dislocated worker grant from the U.S. Department of Labor. Then in kind of the middle part of the initiative, we were funded through governor's commission funds, which comes from New Hampshire's alcohol fund. And then our current funding, so we over doubled our budget, which was really huge for us. I think we worked really hard to demonstrate outcomes and reach and impact. And we were actually written into the state's budget. So the governor puts together a budget, and then the House and the Senate each kind of take a look and make edits, and then they all come together and see, you know, what they agree upon. Does it need to be reworked some more? So that was really like a win for us, because it's not every day that treatment, prevention, recovery programs get written into a state budget like that. And so that's when we were awarded the $1 million a year for 2 years. We have been written into the state budget again. The governor committed to funding us fully. Now, of course, it does have to still go through that entire budget process, but we are feeling very hopeful that the funding will continue, and really appreciate her support there and her commitment to behavioral health. And then Jeanne's work is funded in part by this HRSA grant that we are receiving through Dartmouth Health. And so that was for about $100,000. We got that for 1 year, and then we got it for another year. Now, a little bit more about some of our materials and our model and some of the updates there. So the checklist, we love the checklist. It's a very solid, pragmatic document. We really have not received any negative feedback from the business community, but there is one, I'd say the biggest piece we want to add is prior to designation, we are going to strongly recommend that one or more people from the company receive our RFW Foundations training, and that covers the topics listed there. Now, Jeanne requires this as part of her program, so any workplace that wants to participate in our workforce development scope, they have to do this RFW Foundations training. So we're excited about that. The deck is all developed and the team has been piloting that. And then just like the optional components, probably going to put a few more examples of what it might look like to gather information to inform their approach, like an employee survey or a cultural assessment tool. And then some additional asset development we've been doing that's kind of informed by all this field work and supporting the model is we're updating our orientation packet, and we're going to have a document around working with your advisor, which is kind of like roles and expectations to help with kind of like a level set and just coming in all on the same page. I think if you have a program with, especially if you have like limited capacity, that probably is like good to kind of get that information up front. For us, like our advisors are working with anywhere from 80 to 100 workplaces. So just kind of supporting them and supporting the businesses. We are developing a next steps menu that's going to kind of be like, okay, so there's this checklist of, items that we're asking for, and like, what else can this look like? So that will go into that a little bit further. It's been awesome watching the team develop some really creative assets. We have an accessing resources flyer. Shout out to Ohio. That was inspired by the Ohio team with the QR codes. We did a similar one. One of our staff members did one for Narcan that's similar. And we're updating our training menu. And then I know a lot of people are super interested in evaluation. So just as a reference, this was the first survey that we did in New Hampshire, really asking the business community about their participation in RFW and what that's looked like for them, and not the business community at large, the recovery-friendly workplaces that were participating with us. And it was great. It was really good. It was insightful. It was encouraging. And also, we are working with a new evaluator now, and we've just, I think, been able to take a little bit of a step back and really think about what can we reasonably collect in terms of data in this space. And I know a lot of us feel this pressure to kind of get this like ROI kind of data. And in practice, that's very hard to get with a degree of like accuracy and confidence. And so it's kind of like, you want to make sure that there's a lot of quality in your evaluation plan. So I think that we've really kind of looked at, especially with evaluation, fidelity. So you can't really evaluate your model effectively if you don't understand first to what extent people are doing your checklist in your program. Now, in our prior evaluation, we did ask people to self-report the elements of the program that they had been doing. So we definitely did have that fidelity piece. But the biggest thing now is that we've kind of rolled in some of this evaluation to our annual designation renewal process. So the advisor is going through a form with the business and talking to them about what they did that year to meet the checklist components. And then we have this individual section, so the advisor will hop off, and then there's some more questions kind of around outcomes. Especially we can kind of get at a little bit more of those proximal outcomes, some intermediate outcomes, and then we're going to be talking with our evaluator around what more of those long-term outcomes look like, what does causality look like, and they put together a really nice graphic. These graphics come from them. And I just think they're really helpful. So you want to make sure that your model is strong and then that you are really effectively implementing it. And then you can kind of look at outcomes. And then from there, you're looking at kind of correlation and linkages to your theory of change. So you want to make sure you have a theory of change. And then from there, you can progress more into this causal attribution. Now, full transparency, they did inform me that can be really hard to get to for a lot of programs. And I did ask them to like, give me an estimate of what would like a quasi-experimental study like run us. And they said like 1 million and up. It definitely could be 1 million and up. But I just wanted to throw out there for programs, like I still love asking people like, how helpful has this been for you? Like you could ask, would you refer another business colleague to it? Like there's so many nuances and things to think through in terms of data collection. But we do have some questions like, what are the most impactful changes you've seen as a result of being a recovery-friendly workplace? There's some of the drawbacks being potentially like social desirability bias, or like the biggest thing the evaluator pointed out to us is like sometimes people can't always link like this happened because of the initiative. And also recovery friendly is so rich because it's a suite of activities that we're doing, which also makes it challenging sometimes to evaluate. But this is underway. We are starting to see some preliminary statistics, and it's really exciting, and more to come from this space. I think one of the things we're interested in possibly doing and building upon further is doing an employee survey. So it's like we're seeing how the points of contact are receiving this, what are their perceptions of impact, but then like we know that we want to reach employees, and to really like more accurately assess that, we need to be able to talk to them and ask them questions. I'm running out of time. I told my director of workforce development, Jeanne, that I would give her 5 minutes, and she's like, I don't need 5 minutes. I'm like, you should have 5 minutes. I don't need the 10, but we're up to over 400 participating workplaces. We have a lot of like projects underway. I've been involved in that a lot. We're currently funding 10 partners to help us with recruitment. I could do like a whole talk on that and things we've learned. They got 33 letters of interest for us last quarter, which is really impressive. And then I just have some anecdotes from the field, including training around 300 state troopers to be able to administer Narcan and equipping them with kits. We've heard 2 stories of lives being saved due to Narcan trainings we've done, and we often do distro along with that. And then just a quick quote from the workforce development offering. Someone wrote to Jeanne and said, the encouragement and help from you made me keep fighting. And with that, I'll turn it over to Jeanne.
Hi, everybody. My name is Jeanne Venuti. I am the Director of Workforce Development for Recovery Friendly Workplace New Hampshire. I was an advisor for 4 years before taking on this role. So Sam and I have been with the initiative since it launched, which is such a huge privilege. About 2 years into my role as a recovery friendly advisor, I noticed a lot of businesses were asking about hiring people in recovery. We're bringing them the resources and trainings to help them support their current workforce, but they were starting to feel like, okay, we feel well equipped to now invite people in recovery to come and work with us as well. So at the time, I was able to refer them to different programs around the state, but I wasn't able to fully immerse myself into the work because I had to, stay within my role as a recovery friendly advisor. So I'd been asking about this role for quite some time and even brought it to our advisory council, who were extremely supportive of it, but we didn't have any funds that we could dedicate to it at the time. I'm also going to add, I get very excited about anything workforce development. I have a history. That's what I did before coming onto recovery friendly workplace. So, I'd ask about it every once in a while to see if we could get it into our budget. When our budget was increased, and we could add to our staff, my role was actually written into the budget, which was so exciting. But then right around that time, we were approached by Dartmouth Health, who wanted to partner with us on workforce development activities through the HRSA Health Resources and Services Administration funding. And so we're now in our second year of partnership with them. So I had 2 goals when I came into this role. The first was to act as a connector between programs around the state that support people in recovery with their job search activities and our recovery-friendly workplaces. And the second was to make sure that I wasn't duplicating activities that were already taking place throughout the state. So before I started my work, I did some research. So phase 1, I call it phase 1 and phase 2. Phase 1 was last year, and I started out with interviews. The interviews were conducted to kind of figure out where the gaps were around the state and where the needs were. So kind of to figure out what my role was going to entail. So I interviewed 7 recovery-friendly workplaces. I did 5 individual interviews with individuals in recovery, and then 6 interviews with different programs around the state that support people in recovery with their job search activities. So the results of the interviews showed pretty much the same thing, that each group was looking to be connected with the other groups, but didn't know where to start, or they hadn't even heard about the other groups. So at that point, I began meeting with businesses to discuss their hiring needs. I gathered their job descriptions, and then I also found out what their policies were related to background checks, and any other nuances that they wanted to share with me so I could help vet potential candidates and take some of the lift off of them. I also met with various programs to let them know about my new role, and then I occasionally met with individuals to help them with their job search. Programs began reaching out to help match their candidates with jobs, and I continued to educate businesses about the program available to help them with their hiring needs. And the last thing, which I just finished this up a few months ago, is something that we're so excited about. It's an asset map. It's a map. It's a live map, so I can update it at any time. I created it through Google. It's very cool. So it shows the state of New Hampshire. Everything is color coded, but I developed it to help businesses locate services that their employees may need or they may need. Like I said, it's updated live. It consists of services such as recovery community organizations, mental health centers, recovery homes, and workforce development programs. So you can choose an area and the color on the map associated with each service. So you can see where each service is located in the state of New Hampshire, obviously in relation to the business as they're looking at it. So next we're going to move on to phase 2. I noticed pretty soon on that some businesses were connecting to the programs, but they weren't as engaged as I had hoped, really realizing that they were looking for more of a direct connection to potential candidates. So this brought me into the phase 2 to bring individuals the tools that they needed to be able to apply for jobs at our recovery-friendly workplaces. and also to deliver these to the programs that are supporting people who are looking for jobs. So in order to find out what their needs were, I decided to conduct a survey, and I was able to capture data from 18 individuals to find out if they had received any assistance from programs, and then to find out what they were lacking for tools. Some received services and training, but the training being offered was too much of a time commitment for them when they had other obligations. Some of them already had jobs. They were looking for help with resume writing and interview skills, as well as assistance with their actual job search. So I took all this information to develop a series of 4 training courses. Each one is about an hour long, and each can be taken in different modules, so they don't have to be taken all at once. So people can take the ones that they need, and then do not have to take the ones, obviously, that they don't. I also want to present these to the programs that are supporting people in recovery, such as the recovery community organizations, because a lot of times their recovery coaches are also assisting them with workforce development, with job search activities. So I wanted to educate them as well, so that they can use these trainings to help the individuals that they're working with. And so the 4 modules include cover letter, resume, and follow-up, how to write a cover letter and resume using either ChatGPT or a pre-made template, learning how to customize each resume to the job that you're applying to, and then writing an effective thank you letter or email and why it's important. The second is the interview process, how to prepare for an interview, including how to have conversations about gaps in employment, as well as background checks. The third is career exploration and job search, which I'm working on right now. Now they're ready to search for that job, but sometimes they don't know what they want to do. So the career exploration just involves different activities and assessments to kind of see where they might fall as far as their interests, maybe their job history, etc., to find out what they want to do next. And then also the job search portion is how to find jobs that they'll enjoy and be good at, according to their interest in work history. And then the last.
So sorry to cut you off. I think we have to move on to Colorado. So if you could wrap up and we'll move on. Thank you so much to New Hampshire. This has been fantastic. I think you just have one slide to show contact information, and then we'll move on to David.
Our one pager.
Thank you so much to both of you.
Thank you.
Thank you.
Great. Thanks, Eliza. Thank you so much, Sam and Jeanne from New Hampshire. The work in Colorado builds upon the foundation of these states that came before us, and you certainly have helped lead the charge and provide such a strong foundation for what we're about to talk about today and what we're working on here in Colorado. My name is David Shapiro. I use he, him pronouns. I am a white male in my late 40s. I currently have dark brown curly hair, a full beard, and I'm wearing brown glasses. I'm coming to you today from my office in Aurora, Colorado, and it's my privilege to speak to you a little bit about the work that we've done in Colorado since 2022 on developing and launching the Colorado Recovery Friendly Workplace Initiative. We're in a little bit of a unique position in Colorado, having been part of this national community of practice since its inception, in that we get to be located within a research and academic institution. So the Colorado School of Public Health is actually located within the University of Colorado. And so I'm part of the University of Colorado's Anschutz Medical Campus, closely connected to the School of Medicine, the School of Pharmacy, and the other schools that are here on our Anschutz Medical Campus. So we are a public health research academic institution. I am not in a faculty role. I'm in a practitioner-based role. And so I get to primarily work with companies on their commitment to workplace health, safety, and well-being under the NIOSH's Total Worker Health Initiative. And so this initiative, or certifying companies as recovery-friendly workplace, was really something that we were well suited to do when we had this opportunity come up and arise, because we were already certifying companies as healthy and safe workplaces for the past 12 years under our HealthLinks Healthy Workplace Certification Program. We have some signature programs that I just want to mention. I mentioned HealthLinks, that's putting public health into practice. That's really our main total worker health outreach strategy. We Can Work is a project that is relevant to this conversation because it's specifically looking at individuals with cancer diagnosis and what they're experiencing experience looks like. And then the Colorado Recovery Friendly Workplace Initiative really does a great job blending both our organizational outreach strategies and working with individuals with specific lived conditions and medical conditions like recovery from mental health conditions or substance use disorder in general. We have a little bit of a different definition on what is a recovery-friendly workplace based on the 2022 toolkit that Colorado launched compared to the Institute. When we talk about a recovery-friendly workplace as an employer or an organization that uses evidence-based policies and practices, so you'll see those words policies and practices mimicked between both the national definition and ours, to bring the organization together, to unite the organization by recognizing recovery from addiction as an asset or a strength, and by being willing to work intentionally with people in recovery. And I'll talk a little bit more about how organizations engage in the Recovery-Friendly Workplace Certification Program in just a moment. But before I do that, I want to talk to you a little bit about our history of what we've done over the past few years. So we started with a small grant through the Colorado Consortium for Prescription Drug Abuse Prevention, which is a center at the School of Pharmacy here on campus. It was a pass-through allocation from American Rescue Plan Act dollars through COVID funding that helped launch the conversation around the Recovery Friendly Workplace Initiative. And the first thing we did was convene a group of business leaders. We knew that one of the things that's keen and important to me is anytime we're going to launch a new program, we're informed by the human resource professionals, safety managers, worksite wellness folks that are already doing this work in the field, and in this case, in workplaces. And so we wanted to find out what organizations were already doing in Colorado. So we convened this 4-part business leaders series with primarily human resource professionals in a variety of industries and sectors with a variety of company sizes. That was from fall 2023 through winter of 2024, really to sort of inform what the initiative was going to look like and what maybe a certification program might entail. We had some really great experiences and conversations coming out of that. It did also help launch our advisory group, our employer work group. So up here on screen, I have a graphic from the Colorado Consortium for Prescription Drug Abuse Prevention, which is helping the Attorney General's office in terms of shepherding and stewarding the opioid settlement dollars that come into the state and of Colorado, and we created an 11th work group to their logic model or their work group model, specifically on recovery-friendly workplaces that I am co-chair of with a business leader in the community, Dave Segunda. And you'll notice here on the flowchart that there's already a recovery work group, there's an affected friends and family work group, and then there's several work groups that are related to opioid overdose prevention or benzodiazepine awareness. And what I really appreciate about being part of this group, but not being in the medical community, as we meet as a coordinating committee every other month, and I get to hear more about what's going on in the safe disposal space, in the harm reduction space, and from the leaders of all these other work groups, and vice versa. They're able to connect with what business leaders are doing, either through recovery-friendly workplaces or in the case of things like safe disposal. We've become another pathway for Take Back Drug Days that are coming up later in April to disseminate information specifically to employers, which was a pathway that those work groups didn't have before. So it's great being part of this overarching coordinating committee that's going on for the state of Colorado. A little bit more about the timeline. As I mentioned, we launched a work group in 2023 based on that, the peer learning series. We did participate along with Dr. John Narine from Colorado in LAPA's advisory committee for legislation, state legislation around recovery-friendly workplaces. And we were able to propose that legislation, that model legislation, in August of 2023 as a potential bill to be introduced in Colorado State Legislature for the 2024 session. Lo and behold, we did introduce the Recovery Friendly Workplace Certification Program with bipartisan co-sponsorship in January of 2024 on the first day of last year's legislative session. That was Senate Bill 48. And interestingly, we were part of a package of bills that were introduced, one on treatment, one on prevention, one on harm reduction, and we were part of the Substance Use Disorders Recovery Bill. It went through all of the various stages of committees and approval processes, and we passed with bipartisan support and were signed into law by Governor Polis in May or June of 2024. And we began implementing the program, the formal certification program, in July of last year. Just a little bit about Senate Bill 48. There's sort of a high-level summary up here on screen. There's a couple key words here about the legislation that it instilled. One is that it's a voluntary employer program open to any employer of any size and in any sector. It is administered by my place of work, the Centers for Health, Work, and Environment at the Colorado School of Public Health. There's some requirements of what the program is going to have, like the rules and the certification process. There's some requirements on what the company is going to do in order to get certified. And then it gives us the latitude and leeway to contract with advisors and consultants, which we've done over the past year to help us build the tools and resources we need. Okay, I'm going to shift gears here and talk to you a little bit about the actual certification process, because I know, drawing on the heels of the very clear New Hampshire checklist, we've sort of built our own stages and steps of how to walk a company through actually becoming a participant in the program and then getting certified. We start with signing a letter of intent or a letter of interest, and I'm going to pull that up in just a moment. We ask for a decision maker at the company to fill this out. It is an online form, and it does capture number of employees along with sector of the industry that the organization is in, the county, and their physical address, and so that we can populate a map of the companies that are participating. So that's step one. And we do really ask for a decision maker at the organization, and we do ask for them to check the box that they're willing to share their name and their logo on our list of participating companies. The next steps are flexible in terms of when and how a company completes them. And what we've seen from the currently 106 companies participating in our program is they generally happen in the same order, but they can happen out of any prescribed order that we define for how this is going to work. We do offer a virtual orientation session to organizations. That's a 25-minute virtual session, and we have an orientation packet that couples the conversation that we have during those sessions. So immediately upon signing the letter of intent, the individual that submitted that form gets a link to schedule an orientation session with me or one of the other advisors in the program. We kind of feel like those first two steps, a letter of intent and orientation, might take an organization in terms of even completing the orientation session about an hour, right? And then the longer work begins on the organizational survey and the training that we've created as well. Maybe that's another 2 to 3 hours of commitment on behalf of the organization. And then once these steps are completed, then the company becomes certified or designated as a Colorado recovery-friendly workplace. And they sign an agreement on how they're going to use the badge, how they're going to use the marketing materials that we provide them. And we're just in the process right now of issuing our first certifications, which we're really also very excited about. Have the website up here on screen, and I'll make sure that you all get that as part of the follow-up. I know that the font gets a little small here on screen, but I wanted to just share with you some of the resources from this first step. The letter of intent, I mentioned that it's really important that we get a decision maker at the organization to sign the letter of intent. In government institutions, that can be a division director. We had Colorado's Attorney General, Phil Weiser, sign the letter of intent on behalf of the Attorney General's office. We've had division directors at on government divisions and departments sign it. And then, of course, we've had small business owners, operators, and human resource managers at companies sign it, all of which are in some form of a decision-making or a C-suite role. There's 4 things on the letter of intent that the organization is pledging to do. One is that they're creating a workplace where it's safe to have an uncomfortable and many times difficult conversation about addiction and mental health. 2, that they're willing to educate employees about the dangers of substance misuse, impairment, and dispelling the myths and stigma, working to dispel them around addiction and mental health. 3rd, that they're willing to support employees and their family members access high-quality prevention, treatment, and recovery services. And then finally, that they're willing to create and work with our initiative to have a healthy, safe, and stigma-free work environment. A couple other graphics up on screen is our online scheduling system. So when you click on the link, it pops up with times available for these 25-minute virtual advising sessions, and they go to a variety of different advisors we have available. There's 3 of us that host these sessions here on my team. And then the orientation packet is a nice PDF that sort of mimics any conversation that we're going to have with an employer through the letter of intent and orientation session process. I mentioned the survey, the organizational survey. This is something that as a research and academic institution, we've worked on for a long time. We've deployed this specific survey since 2021. It came out of conversations with organizations and employers through COVID that were understanding that mental health was the next pandemic after the infectious disease of the coronavirus. And so we've made a few refinements on this tool since 2021, but we did have a convening overarching advisory committee to launch this survey back in 2021 that included representation from Mental Health America and the Bell Seal application, along with a couple of depression centers around the country, including the University of Colorado Depression Center and some representatives from Michigan as well. And so this is a survey. It's an organizational survey. It's about 16 questions, 1-6. Like I said, it takes maybe 45 minutes, 30 to 45 minutes to complete thoughtfully. And this is an organizational survey. The questions are broken up into 4 categories: culture, benefits, training and education, equity, and accessibility. And I do want to mention this is a broader survey than simply asking questions about how you're supporting individuals in recovery from substance use disorder. It's really meant to assess how the organization is supporting mental health more broadly, with a few specific questions on substance use disorder, awareness and education around substance misuse and impairment, and policies and programs, practices around supporting people in recovery. And then lastly, we're really excited that over the past month, we launched in our learning management system and in the University of Colorado's learning management system, our foundational 101 online course called Supporting Employees Affected by Substance Use Disorders. It's a 60-minute interactive online course that really helps set the stage for everyone to be on the same page. And it has some very specific criteria and components that we want to make sure companies participating in our initiative have the same baseline understanding, like what is a substance use disorder, what is a psychoactive substance, and how do they contribute to impairment, and how recovery is a process of change. We also talk about the keys, successes and obstacles for supporting a workplace-supported recovery, understanding through employer stories what perspectives are from employers, and we want to make sure we mention the legal protections like the Americans with Disabilities Act and other Family and Medical Leave Act, FMLA, and other kind of core policies and practices that are available to individuals with this medical condition, with this lived experience. And then, it is part of the certification process. So we've gotten a really great reception to the online asynchronous version that's currently available. And we are also presenting this content in person. We know that online and asynchronous is not going to work for a lot of employers, and therefore we have trainers who are presenting this content in person. With the first one we rolled out last week, and we were able to present the content bilingually in English and Spanish as well. Just as I wrap up here, we have currently 106 companies participating. We're getting excited to issue the certification badge to the first set of about 15 or 20 of these companies that have completed all of those steps that I just mentioned. We have an interactive map on our website where you can download a list of names and access the websites of the companies, and kind of see the filtration or the penetration of the program throughout our state, right? It's pretty classic in Colorado that engagement for these programs happens up and down what we call the I-25 corridor, which is that cluster of dots in the middle of your screen that goes from Fort Collins, Colorado in the north to Colorado Springs, Colorado in the south. But we've had some good success in the mountains communities on the western slope and down in southwest Colorado as well. We're missing some agricultural partners in the far east and northeast corners of our state, and we're working hard with partners to try and recruit more pins to be dropped in that upper quadrant of the map. It's important that we're informed by personal stories. So when you go on our website, you'll see some videos that we launched our website with. Ruth is a nurse in recovery from opioid use disorder and shares her story. Kara and Cliff are business owners from a restaurant in downtown Denver, sort of a fast casual that are both in recovery from alcohol use disorder and primarily employ individuals in recovery in their bar and restaurant. And then Grayson is in the construction industry and shares his story about opioid use disorder and being in recovery from a construction industry. So we have kind of broad representation in terms of industry partners here, and these videos are all under 5 minutes in length as well. But it is really important that we tell the personal stories that are attached to recovery-friendly workplaces. And finally, just like any occupational health and safety conversation I have with the business community, the example I always give is ergonomics. If I do a training on ergonomics with a company, undoubtedly, employees will start raising their hand and talk about how their wrist hurts or their knee is achy or they have some hip pain, and they didn't realize that that was related to work. But after learning more about ergonomics, they want to know more about how their work accommodations and work situation may be contributing to these nagging pains that they've had. we're expecting and or have already seen that recovery is the same type of conversation. The more we talk about it, and this is a good thing, the more we talk about it, the more people are going to raise their hand and need support and ask for resources around treatment and prevention. And therefore, we keep an active recovery resource guide that one of my team members sort of updates on a weekly basis with what treatment options are available. So we've sort of vetted a little bit for the human resource professional where to go, how to contact your medical plan, and what sort of questions to ask when individuals come to the HR manager, the safety professional, and are asking for resources. So this is a really important component of the program that we make sure we have active and up-to-date resources available for people that need resources and treatment recovery resources upon completing the components of RFW. My contact information is up here on screen. I know many of you on the call. I'm happy to share the Colorado experience with any of your other states to see what can be duplicated, and I know I've already done that with a number of you. I'm happy to connect on progress, to provide suggestions and advice based on what we've learned in Colorado. These are tough times for occupational health and safety. Many of you that may be tracking what's going on federally, we are committed to continuing this program regardless of what happens at a federal level or even at a state level. And so this is now a hallmark and signature program of the Colorado School of Public Health, and it's been embedded in what we do as a research and an academic institution. Public health and occupational health and safety will come through the current times, but we may look a lot different in a few years than we do today. So again, I really appreciate the passion and perseverance and dedication that all of you have shown in doing this work. And I'm here to answer any questions and help support your state in whatever the next phase of your recovery-friendly workplace program looks like. Thanks, Eliza.
Thank you so much, David. So well spoken. And I'll save questions for the end so that Jeremy gets a chance to speak about his. I can't speak highly enough of you four on this call. So Jeremy, take it away.
Great. Thanks, Eliza, and thanks, David, and colleagues from New Hampshire. New Hampshire and Colorado have really paved the way for a lot of this work. Minnesota is in a much different place in its recovery-friendly workplace journey, so to speak. And I'm just going to share my screen real quick, bring up the slide deck. Hopefully everyone can see the slides.
Not yet.
Oh, I see. I'm a Teams guy, unfortunately, from state government. So how about now?
Yes, perfect. Thanks, Jeremy.
Okay. Great. So maybe just some background context for where we are here in Minnesota. So in 2022, the governor and the legislature created a sub-cabinet on opioid substance use and addiction. So this is a thing that the Walz-Flanagan administration, who I work for, has really prioritized, is these sort of sub-cabinet agencies or these sub-cabinet groups that bring together multiple state agencies that all touch on a very complicated topic. So whether it's the Children's Cabinet or a health sub-cabinet or an interagency council on homelessness or a climate change sub-cabinet, when there are these big topics that touch different areas that multiple agencies touch, the Walz-Flanagan administration has really emphasized creating an interagency lead that really helps break down silos, coordinate and align work, and really try to drive progress across the different agencies who may have different statutory authorities or focuses. So in 2022, the governor and legislature created the sub-cabinet on opioid substance use and addiction. It also created the position which I occupy now, which is the addiction and recovery director. So this is a cabinet level position. So I report directly to the governor. And within the sub-cabinet that I administer, we have the departments of human services, health, education, higher education, management and budget, corrections, public safety, and then the interagency council on homelessness. We also have a governor's advisory council on opioid substance use and addiction, which I assist in leading. And so what this really does is it elevated addiction and recovery issues into the sub-cabinet or into the cabinet level so that there's really a direct voice speaking to the governor and our policy leaders on these types of issues. And this really, and so I'm the first person in this role. And so it's been a bit of a startup over the last couple of years as we've really kind of defined and created sort of what our focuses and priorities are. But very early on, we identified recovery-friendly workplaces as an area that really fit within the Office of Addiction and Recovery, which I administer as well. So what that means is that we're able to be a cabinet level voice speaking directly to the governor to advocate for some of these issues. And especially in Minnesota state government, just the structure of Minnesota state government is such that there's not a natural home for a recovery-friendly workplace initiative in any individual agency, but it really makes sense for my office then to kind of pick it up and be a champion for this work. When it comes to the Office of Addiction and Recovery, which is the office that I lead, our core functions are to coordinate and align efforts across state government, look for new interagency opportunities, promote innovative programs, conduct robust public engagement. We do provide oversight over programs that are administered by state agencies, and then create and maintain a database of relevant program spending. So again, really focusing on that coordination and alignment function, and also that promotion of innovative programs, which is really one of the areas in which I think the recovery-friendly workplace initiatives really fall. So sort of the history of the recovery-friendly workplace initiatives here in Minnesota, we got funding in our 2023 legislative session for our Minnesota Department of Health to work with employers on recovery issues. It doesn't exactly spell out creating a recovery-friendly workplace initiative, but it just sort of sketches out that our Department of Health should work with employers on recovery issues. Subsequently, we attended a National Governors Association Policy Academy where we met with Eliza and some other states that were all working on recovery-friendly workplace initiatives. And while that was not the focus of our sort of thesis in that policy academy, we really took a lot of inspiration there from what those other states were doing, and from the presentation that Eliza gave, and for some of the things that we heard from our federal partners at the time around the importance of recovery-friendly workplace initiatives and a lot of the work going on around it, and brought that back to Minnesota and really thought about how could we advance that here in the state of Minnesota under the auspices of this legislation that was passed in 2023. And so in October of 2024, the governor signed an executive order that directed the state of Minnesota as an employer to become a recovery-friendly workplace, and also re-emphasized the importance of that 2023 legislation with the Department of Health to really work with employers outside of state government on recovery issues, and to really move forward on a statewide recovery-friendly workplace initiative. So currently where we're at right now is we're currently implementing both the statewide and the enterprise-wide recovery-friendly workplace projects. And we think of it as kind of like track 1 and track 2. So track 1 is the state enterprise as an employer becoming recovery-friendly, and then track 2 is the broader statewide initiative. Where we're at with the statewide initiative is really looking at how to creating a roadmap to developing that statewide certification. So again, much further behind both New Hampshire and Colorado, but definitely taking a lot of experience and knowledge from what they're doing as we begin to develop what that certification process might look like, and begin to engage with our employers. One thing I would say is we've had a lot of sort of informal conversations with different employers, and particularly with unions. Our building trades union in particular is very interested in the recovery-friendly workplace initiatives, and they see it as a key piece of their workforce development and their workforce retention. So just to go through real quick, sort of what the executive order sort of lays out, but Minnesota Management and Budget, which is our enterprise-wide human resources department and also where my office is located, the Minnesota Department of Administration, which manages the facilities around the state of Minnesota, and our procurement processes, and the Minnesota Department of Health are directed to collaborate and facilitate conversations with one another and state and local health agencies to provide education on substance use disorder to all Minnesotans. But in particular, we are charged with identifying ways to support state agency employees and their families in recovery, to research, design, and provide trainings for state agency employees on reducing stigma attached to substance use disorder, and identifying resources available to state agency employees and their families. We're also charged with working with the Department of Administration on the feasibility of procuring and distributing opioid antagonists, so naloxone, for state agencies to include in emergency kits, and then collecting all of that information on the progress that agencies are making and reporting it to my office. We also have the Department of Health, which created a few years ago an opioid epidemic response employer toolkit. And so we are updating that toolkit, and then we'll be working to distribute that across the enterprise to ensure that there's uniform training, education on opioids and substance use and misuse prevention, response, recovery, and support. Additionally, and this is where the executive order really emphasizes that legislation from 2023, is to work with private employers and local governments as well to implement and expand the statewide recovery-friendly workplace initiative that was passed in the 2023 legislative session. And then again, MDH will provide technical assistance to the Human Resources Department on some of the trainings that we'll be doing. And then finally, my office will be responsible for reporting on progress that state agencies are making, producing an annual report, and then working as a facilitator and a convener across state government in order to achieve the goals set forth in the executive order. So right now, we are convening the department heads with Eliza's help and some other folks. We're really convening state agency heads, the human resources leads, about levels of readiness around where Minnesota state government might currently stand when it comes to national certification standards. We're really using the National Recovery Friendly Workplace certification document to analyze the gaps where we where we can do better, where we might want to sort of up our game a little bit and find out what are the best ways to do that. Really looking at and reviewing and providing input on current SUD related policies that affect state employees, reviewing the current resource landscape, and then developing a communication strategy around how to really bring this to fruition and get it out to sort of our employers or employees. I think some of the other things that we're thinking about too, just sort of off the cuff, are thinking about the way that the state of Minnesota as a purchaser of healthcare. The state of Minnesota has about 40,000 employees, and our insurance benefit is called CGIP. But thinking about how we can use sort of our leverage as an employer to drive changes in the commercial market. So thinking about in particular things like peer support. Peer recovery support is a Medicaid covered service in Minnesota. Not widely covered though in our commercial plans. So thinking about how the state of Minnesota as a purchaser of healthcare can maybe help drive progress in the individual market and private market, commercial market, in terms of what are some of the services and benefits that that could be covered under some of those plans. Also thinking about sort of our employee resource groups. We have different resource groups for different affinity organizations like LGBTQ plus. Other organizations, but have had a lot of employees reach out to me in this role, kind of asking about, could there be a recovery-oriented affinity group? And so thinking about what some of those things might be in terms of resources and supports. And then I would also maybe just finish up by saying, we are taking, we're fortunate in Minnesota that the governor has really made addiction and recovery issues a signature part of his administration and really elevated it through the subcabinet. And so, we're fortunate to have the subcabinet that we have in the position of the addiction and recovery director, who in addition to some of these innovative programs and coordination and alignment issues, also serves as the primary advisor to the governor on substance use related issues. And so, this position, whoever will occupy it, into the future, often serves as, an individual that looks at sort of the broad landscape of substance use disorder services and supports, looks at budget and policy proposals, and really serves as that top advisor. So, really having a position elevated in state government to advocate for these issues has really been advantageous in Minnesota and really moving forward on some key initiatives. And the recovery friendly workplace one is a top 3 initiative for my office. So I see it's 11:54, and we would certainly want to give time for a few questions if we can have them. So I will pull down my slides and turn it back to Eliza, and hope that we can get a couple questions in here. Thank you so much.
Thank you, everyone. As you all can see, there's so much passion in the room between Colorado, New Hampshire, and Minnesota. What you'll learn as you're starting a statewide initiative with the guidance of these experts and with the help of the National Institute, this is something that catches like wildfire. So I put contact information in the chat if you have any state-specific questions for any of them. But if you'd like to raise your hand, come off mute and on camera to ask your question, feel free to do so. I'll field those now. And if you don't want to do that, please put them in the Q&A box. Hi, I see you have your hand raised. You're now permitted to talk.
Yeah, hey everybody. Ty Reed from Washington State Employment Security Department. Thank you everybody for a great presentation today. I'm just curious, there was a lot of information shared. Are we going to be able to get copies of the slides? I know there's a link to the video presentation itself, but I think copies of the slides would be helpful as well.
Yep, and the follow-up materials for the webinar, we will send a PDF copy of these slides because I know it's a lot to digest. It's so much great information.
Thank you.
Tommy McCann, you're now permitted to speak.
Hey, thank you. Great to hear you all. I'm Tommy McCann from Massachusetts. Question regarding, I know in, say, New Hampshire, I believe it's Granite United Way. Is that the name of the nonprofit that administers it? Does it need to be that sort of setup to really get a state initiative going, or can, say, the whole thing kind of be run through, like administered through the state? Say I work with the Department of Mental Health. So I'm curious as, does it need to be kind of this administered elsewhere to really get going? Hopefully that makes sense. And then I also had another question about, is there ever a thing with like integrating a recovery supportive EAP into the whole system to help ensure that, you know, employees from all recovery friendly workplaces get the support they need with navigating the whole system? Because I'd worked for the Massachusetts as a state EAP, and I was blown away with how much it supported employees in terms of navigating. It was unbelievable, and that's what turned me into looking at and learning about recovery friendly workplaces. So before I talk even further and go on, that's all I got.
Thanks, Tommy. I'm not sure if anyone has anything to add, but I'll address the first piece, and that's that we know of successful models across the country, state by state, that aren't per se run out of a nonprofit, like David's model being out of an education system. We know some that live in government, some that don't. So there's a lot of models. We have our recommendations of what we think will help in terms of sustainability, which would be an independent nonprofit. But there are successful models across the country that have been implementing this work, not run out of Granite United Way, for example.
Eliza, I would just add to that the Institute spent a fair amount of time talking to employers, because that was one of the things we wanted to hear from them, of what were they interested in, you know, how did they react? And honestly, many employers told us that they liked the idea of an independent organization from government, only because they found that there was hesitancy in their organizations around getting involved in a certification that the government does. And so that is one of the reasons that we came to the conclusion that we wanted to really encourage for each state to have a statewide organization that could be housed in an already established nonprofit. It could create their own nonprofit. It could be somewhere where they were independent from government in doing the certification process and providing the resources.
I can speak briefly to the second point about EAPs, in Colorado, we're actually advancing employee resource groups first in companies that are participating in our initiative that maybe have a trained peer support specialist from an EAP that helps facilitate the employee resource group. It was always our model that we wanted to get the foundation and core of hopefully a few hundred businesses participating before launching an EAP model. We felt like we needed that ground swell and support of employers. With some shifts in federal and state funding, we've decided to advance some of these more boots on the ground employee resource group model and proposals. And so the current proposal we have out actually for opioid settlement funds in the next round of funding is to create a EAP light model in companies that are participating in this initiative, where they'd have resource groups, they'd have monthly meetings available, et cetera, and then a trained peer supporter, whether that be in the company or through one of the peer recovery organizations, the recovery community organizations in Colorado. So we are working on that model, Tommy, as we speak, with the hopes of funding on that being coming through in June.
Thank you for your answers. I know we wish we had more time for questions with these experts, but their contact information is in the chat. Once again, our inbox is always open, info@rfwinst.org. And I just want to thank the panelists one more time for sharing their wealth of knowledge. We really brought this core team together as a way to show New Hampshire's expertise in having a program that switched governorship, having someone that has gotten it in the state budget, having someone that has legislative and governor support, and then also that executive order is a great asset as you're thinking of if that's the route that makes sense for your state. So always willing to share. I know that our panelists are as well, so please feel free to reach out to us with questions.
Thanks, everybody.
Thanks, everyone.
Thank you.